So a dentist would recommend dental fillings is in different kind of scenarios. So one could be that if somebody has a cavity on the tooth, which that is one of the very most common reasons to recommend a filling. Other times is that if somebody has lost a tooth structure, so it kind of falls into a category of bonding as well too. So a filling or a bonding can restore part of the tooth structure as well too. There are alternatives to getting a tooth filling. So the alternative could be a veneer on a tooth. It could be a crown on a tooth. Veneer could be an alternative to a filling. For example, if somebody has, chip on the tooth and it's a front tooth and it's not enough for the filling to be there, or the dentist can do a filling, but it's still not going to look that good. So you may have a concern cosmetically, you may not like it after. So in that case, it would be better in this situation to do a veneer so the tooth could look much better and your smile is so much more even and better as well. And other cases on the back molar teeth, it could be that the large filling may not be as stable. You can do that, but in few days, few months down the road, you may break it. So to have a better stability and a better option for you could be crowning the whole tooth. It's like 360, almost putting a helmet on your tooth, making it a lot more stable. So the pros and cons of different filling materials, basically we have two main ones, is the silver, old school silver fillings compared to the newer composite resin composite fillings. So the old school metal fillings, very first thing and the biggest reason is that they need a lot more cutting of your tooth structure, removal of the tooth structure. And versus with the composite fillings, they are a lot more conservative fillings, so we don't need to take a lot of tooth structure, so they can be done very minimally. And other thing is the color. So silver fillings looking silver, they are not aesthetic, so a lot of patients don't like it. So with the composite fillings are tooth color fillings, so no one even knows that you have a filling on the tooth. The other third difference is that over time, silver can create cracks in your tooth because it's a metal, it doesn't change. The tooth structure doesn't change around, but the metal contracts and expands with the heat in our mouth. So that creates crack lines on the tooth, and eventually the tooth ends up breaking. Versus with the composite, we are bonding in, it actually restores the tooth structure and keeps it together. So the procedure for getting a tooth filling is the very first thing is that you come in and most of the time the dentist will give you some numbing so you're comfortable, and we will, if there's a cavity in the tooth, that would be taken out, make sure tooth is all clean and it's safe to put the filling in. And then we isolate the tooth, meaning that with the newer composite materials, we want to make sure that your tooth is nice and dry, we don't have much saliva around for the better longevity of that filling. So we, typically, the dentist might use like a rubber dam, or, we might put some cotton rolls around. So making sure your tooth is nice and dry, and then it almost like put a blue gel on the tooth, and we rinse it out, dry the tooth, then put a little another paint. And, you might see a blue light coming in. That light basically hardens or sets in that material in there. And then we put another layer of like a gel kind of a material. It's a thinner composite material, make the base with that, put a blue light again, and then put the more thicker composite material, put the blue light again. And then the dentist, we check the bite, then making sure that, it's all nice and smooth, you're not feeling anything, and off you go. The way the cavity fillings are done between teeth is that we use something called matrices. So they are different for the front teeth and the back teeth. On the front teeth, you might see it's like a clear plastic film that the dentist will put in between the teeth. They will secure that with a little plastic, we call it a wedge, little plastic piece, and then follows the same procedure with the regular filling, doing the blue, we call it etch, and then you go through all these steps of putting the filling in. And for the back teeth, they are little small metal, we call them matrices again, little small metal matrices that go between the teeth, and the wedge goes in, and we're just basically creating the wall that you have lost. That matrix act as a, like you're baking some pan, like muffins, have a pan. So you put the your dough in there. So similar scenario, we make the wall and we pack in the composite there, and it gives us that structure. perform basically. So dental filling procedure is not painful. And the way we mitigate that is that we make sure that you're very well anesthetized, means you're numb. So that way your nerve is taken care of. It's put to sleep, we call it. So it's, you're not going to feel anything. We take out the cavity, your tooth is pretty much sleeping and it's not going to feel anything, and you should not have any pain. To mitigate your dental pain while doing a dental filling, so I will make sure that you're fully numb before I even start the procedure. So I will ask my patients certain indicators. If we're doing a filling on the bottom tooth, I will ask the patient that, okay, is your tongue, that side of the tongue is feeling numb? If you're working on your left side of the tongue will be numb. If you're working on the right side, that will be numb. Is there part of your lip is numb? Another very good technique that I have learned from some great mentors that I use, it's been very successful for me, that even time patients tell me that, I went to other dentists and, I fell through the procedure. They gave me a lot of numbing, but I still wasn't numb. So there's something very special that I use. It's a small needle. I know everybody's afraid of needles, but I use a very small one. So don't be scared of that. And it's a special kind of syringe that I use. So I'm just numbing that particular tooth. So that way it's not the whole side of the mouth is numb, but also I'm taking care of that particular tooth where somebody may have a problem. And also I, make sure that if, when you're sitting in the chair and once we start the procedure, I want to make sure that you're able to tell me if you're feeling something. You're able to raise your left hand up and give us an indication that you're feeling pain. You need to swallow, you need to close, you need to take a deep breath. We always stop right away and give you that time. So I, like all my patients, I tell them in the beginning that we are in control. We are able to stop anytime you need to. All you need to do is just give us an indication and make sure that I want to make sure that you have no pain when I am doing any procedure on you. You can request a dental sedation when you're getting a filling done. Sedation could be different types. Sometimes patients, may ask their primary care doctor and they might take a little relaxing pill before they come into the office. Other times there are different other kinds of sedation that are present, is that giving you a laughing gas, that you could use that while you're getting a filling done. Fillings fix the cavity which was present at that time of the two when we started the procedure. But I always tell patients that you have to take care of the tooth because the cavity can still form around the filling. Filling material is not going to get a cavity, but your tooth can get a cavity. So fillings typically do not have any side effects. One thing that patients may feel at times is some temporary cold sensitivity for a week or 10 days, but that is transient and it goes away a lot of times, most of the times on its own, and after that patients feel perfectly fine. If you have a prolonged sensitivity which stays on for 2 weeks, 3 weeks, you always want to make sure you let us know that this is what's going on. Give us a call. We want to bring you back in, maybe take an x-ray of the tooth, take a look clinically at the tooth with my eyes and see, make sure that the filling that we put in is all contained, it's well sealed. So we start from there. If the filling is well sealed, the second step could be we will check how you're biting on the tooth. Sometimes when you're numb, you're not able to tell how you are biting properly or not. So if you have a heavy bite on the tooth, that can irritate the tooth. And in that case, we try to take off, polish that tooth off. And a lot of times that sensitivity does go away with that. And in some rare occasions, if it lingers on for too long, and that typically happens when the cavity was too deep and your nerve just didn't like any material going close to your nerve. And in that case, you might end up needing treatment, which is called a root canal treatment, where the nerve may need to be treated. So dental fillings do match your tooth color. So that is another, pro about the dental fillings, which we do these days, that we are able to match the color of your teeth. And a lot of times, a lot of patients have front teeth fillings and they are even second half doesn't even know about them. So aftercare advice after getting a tooth filling is that very first thing and very important thing is that if you are numb, you want to make sure that you're not eating anything until you are your numbness is completely gone, because a lot of times patients end up biting their cheek, biting their tongue, and that creates an unnecessary complication and unnecessary botheration for the patient and discomfort. So very important that you don't eat anything until your numbness is gone away, and avoid anything too hot, too cold for the next 48 hours. Make sure everything settles well in the mouth. So those two are the main things that I always advise patients to watch for after they are getting the fillings done. If you think that you need a filling, the time to schedule an appointment is right there and then. You immediately want to call your dentist and make sure you get an appointment, get seen right away, get checked out, and make sure that it's not beyond the filling or whatever your dentist tells you. Follow that and get that tooth taken care of. I hope we've been able to answer some of your questions. If you have any additional questions or you would like to take the action now, our office number is 603-926-8827. You can call our office now to make an appointment, and I look forward to seeing you guys.